Hello, this is part 9 of our systematic approach to ECGs, focusing on the axis. So let's do a quick review of the electrical pathway of the heart. It's going to go from the sinoatrial node to the atrioventricular node, down the left and right bundle branches. And so what we're going to see is that starting of the electrical current from the sinoatrial node to the AV node, which is going to give us our, as that depolarization occurs, our P wave. And then we're going to see the depolarization of our ventricle, which is going to be represented by our QRS complex. So how do we get our QRS morphology? So imagine a heart, and then across the chest or the precordial leads, V1 through V6. And what we have is the electrical forces generally run from the sinoatrial node to the atrioventricular node. And then, as the depolarization of the ventricle occurs, we have this depolarization of the septum, which occurs in the left to right direction. So because it's going towards V1, you see this upward deflection initially of the QRS complex of V1, and can often see a downward deflection as that septum depolarizes in the V5, V6 region. And then this large depolarization of the remainder of the heart happening rapidly via the bundle branches, but really happening more from a rightward to leftward direction. And then you're going to see a downward deflection of V1 because the predominant electrical forces are going away from V1, and an upward deflection in the V5, V6 region because the predominant forces, in part due to the large muscle in the left heart compared to the right heart, okay, the predominant forces are going towards V5 and V6. And so you're going to see an upward deflection in those lateral leads. Now, the overall forces of the heart then are approximately in this direction, towards kind of the V4, V5 region. So if we look at this and we talk about the predominant direction of the QRS, we say that the QRS is predominantly positive when most of the QRS complex resides above the baseline on our ECG or rhythm strip. We say the QRS is predominantly negative when most of the QRS resides below the baseline. And we say the QRS is equiphasic when there's about an equal portion above and below the baseline. So back to our picture of the heart and the overall electrical forces. If we overlay a chart, you can see that we expect in the gray region, that's where our normal axis of our QRS complex, or the normal electrical forces of the heart, are. And so that's from -30 to 90 degrees. That's our normal axis. Anything from -30 to -90 degrees is considered left axis deviation, because those electrical forces are pointing more to the left side. Anything from 90 to 180 is considered right axis deviation because we're seeing those electrical forces overall moving more to the right. Anything in the upwards or complete opposite direction of what we'd expect is called an indeterminate, or sometimes termed a northwest axis. So think about our ECG then. We know that lead 1 is going to detect forces positively when the forces are pointing towards 0 degrees. And lead 2 when the forces are pointing towards about 60 degrees. So if we look at our ECG, if the QRS is positive in lead 1 and positive in lead 2, we know that our axis then will reside in that normal axis region. So if we have a positive QRS in 1 and 2, we have a normal QRS axis. Another way that you can do this is to look at the computer read. So the computer read here says the QRS axis is 49 degrees. So we then would think about this, plotting it on our chart, 49 degrees, and we see that that lies between -30 and +90 degrees, and so that would be a normal axis on this ECG. So in summary, our QRS axis, we want to do this quickly And so the QRS axis represents the overall direction of the electrical forces of the heart during depolarization. And a rapid way to determine if the QRS axis is normal or not is just to look. Is the QRS positive in lead 1 and positive in lead 2? If it is, then it's normal. If it's not, then a little further evaluation of the QRS axis will tell us if we have a right, left, or indeterminate axis. Thank you.